Have you noticed a slight bulge underneath your jawline where it won't go away no matter how much you tighten your own skin? This bulge might not be fat. It might be a gland. Hi, this is Dr. Roy Kim, board-certified plastic surgeon, specialist in facelift, and I'm here to talk about submandibular glands. We'll be talking about what it does, when to leave it alone, and when it might be holding you back from your ideal neck contour. The submandibular gland, or SMG, is around here, and it's one of your salivary glands. Usually it produces around 70–80% of the saliva that's needed for your mouth. It sits right underneath your jawbone, or mandible, and it produces most of your resting saliva. It's usually not noticeable, but over time, with gravity, with aging, or simply natural prominence, you can make it push downward, and it creates a visible bulge. If the gland is naturally large or starts to sag, it creates a fullness underneath the jawline, especially visible after the age of 40 or 45. It's common in lean patients, and no matter how tight the skin is pulled, the gland still shows. That's why some patients ask, do we need to remove it? We used to remove the whole gland in more aggressive, deep neck lifts, but now we're more selective. I might remove part of the gland if it's very prominent or sags, like a small tennis ball on ultrasound. In patients without dry mouth conditions, it's a great way to fine-tune the jawline. If surgery isn't right for you, we do have non-invasive tools. We can inject a neuromodulator to shrink the gland. RF microneedling or other energy-type devices non-surgically can slightly tighten the skin over the area. These options are great if you want subtle improvements with little to no downtime. When I do operate during a neck lift, I still tailor the approach. I might partially remove the gland and tighten the platysma muscle underneath as a sling. Even during an operation, I may still also inject neuromodulator. Sometimes I only have to tighten the neck muscles as a sling, and I don't even have to touch the submandibular gland. These combinations give a refined, elegant neckline without going too far. Removing a large portion of the gland may cause dry mouth, bleeding, or may cause fluid collections. This is why I aim to remove only for partial excision or even no excision, just enough to contour without taking away any function. I always tailor it for your anatomy, your comfort, and your overall aesthetic goals. If you've been wondering whether your neck bulge is fat, muscle, or now a salivary gland, we can figure it out. Leave me a comment below with any of your questions or what topic that you want me to discuss next. If this video helped you, check out this other video where I talk about facelift and neck lift. As always, thanks so much for watching.